And now on the line is Breda Gahan, a global health advisor with Concern Worldwide. Breda, welcome to our programme.
Thank you, Darren, and hello to your listeners, and thanks for your interest in Concern's work to infectious diseases and currently looking at the coronavirus.
Okay, first of all, thanks for coming on the programme again today, Breda, because I understand you were on Near FM with one of my colleagues only 2 weeks ago. The coronavirus is the biggest news story in the world now, Breda, but I think a lot of people don't actually know what having the virus entails. Can you tell our listeners what are the symptoms of the virus, kind of along with how it started and how it has spread?
Yeah, well, the source of the new coronavirus, novel coronavirus as it's called, is believed to be a wet market in Wuhan in eastern China, which sold dead and live animals with fish and birds. And the science isn't evident, but people believe it was caused by viruses jumping from animals to humans, somehow through bats. It's a zoonosis. And in fact, 60% of all infectious diseases today are caused by zoonosis, when viruses jump from the animal to the human.
Okay.
Like HIV, like TB, like SARS, like Zika fever before, like chikungunya, like the malaria diseases. More and more as human beings, more of us on the planet are invading animal spaces, cutting down forests. We're coming into more and more close contact with wild animals that lived quietly on their own for centuries. So it exposes humans, especially who are handling these animals, live and dead, and selling them in markets, often sold side by side with fish and birds, to increase risk of the threat of viruses, as happened with HIV in the early 80s when it jumped from the animal to the human kingdom. And in terms of the coronavirus, well, I mean, I don't know if your listeners might have heard in the past, but it's from a large family of viruses. We would have come across them in Concern in the past, such as MERS in the Middle East countries and where we work, Middle East Respiratory Syndrome. And most people here would have heard of SARS, Severe Acute Respiratory Syndrome. And I guess the identifying feature with a lot of the coronaviruses is that it seems to affect most the respiratory system. So people have difficulty breathing. The most common symptoms, again, you'll have heard on the radio, people often think they have the flu, like fever, tiredness, cough, runny nose. Some people might have aches and pains. They're mild for a lot of people, almost 80% of the population. But for maybe older people or people with weak immune systems, or people who are on cancer treatment, or people who are living positively with HIV, the situation can exacerbate and a person might become more seriously ill, requiring hospital stay, oxygen, and basically treatment of the symptoms, because there's no treatment or vaccine yet for coronavirus to relieve the symptoms to help them to recover.
Okay, I know most of the work I believe you do in Concern personally is on HIV and AIDS. How does the coronavirus compare to like other transmittable illnesses like HIV, AIDS and other things?
Well, yeah, I mean, I was actually just looking at Concern's country reports from last year, earlier this week, and I did notice that last year in many countries Concern is increasingly responding to health emergency outbreaks, supporting the Ebola response in Democratic Republic of Congo, and then preparing countries nearby for readiness in terms of operational readiness and preparedness in priority one countries like Burundi, Rwanda and South Sudan. We've supported education and prevention for the treatment of Lassa fever in Liberia and Sierra Leone last year. There were ongoing measles outbreaks in Chad and DRC, which actually killed a lot more people than Ebola. Sadly, cholera outbreaks in Burundi and Chad continue, and we work with the local Ministry of Health partners and community health workers on especially education messages for prevention. In Asia, likewise, dengue fever and a outbreak I couldn't pronounce a few years ago, chikungunya, spread by mosquitoes, were real problems in urban Bangladesh last year, which we responded to through our Irish Aid and EU-funded urban health programs. And all the time, outbreaks of diarrhea, acute respiratory infection and malaria remain a major threat for young children and pregnant women who Concern works with. So, the sheer numbers lost due to these endemic diseases in Africa and poorest parts of Asia are much higher than, coronavirus. It's a new one, and a lot more people die from flu. They're very different in terms they're spread by different viruses. Measles in children is much more contagious than coronavirus. And an interesting fact for all of us following this epidemic is that it seems young children and even young adults are less vulnerable to coronavirus than adults and older people. We don't know why yet. It could simply be, I'm thinking of the stature of smaller children. They're not in the coughing line of adults. They're much shorter. And their immune systems are possibly stronger, as a lot of children under 5 would have received the 6 childhood immunizable vaccines. So nobody knows in terms of where this epidemic is going, but so far the data coming out from the World Health Organization and CDC in the US is reporting older people and, unfortunately, a bit like Ebola, health workers, including doctors and nurses who have overexposure to the droplet infection which is causing coronavirus.
Okay, Breda, how likely is it that we're going to have a vaccine or medication to cure the coronavirus anytime soon?
In the best scenario, we still don't have a HIV vaccine. There are many subtypes of HIV, and I suspect probably likewise they'll discover the same with coronavirus. Is the coronavirus in Italy exactly the same as what emerged in China, which is ongoing also in Iran right now? In the best scenario, a vaccine to be tested and approved for safe use would be 8 to 12 months. There's no special medication, and antibiotics do not work for viruses. That's why, there's no point in taking antibiotics for flu. It's important to treat the symptoms for people who are severely affected. Paracetamol for fever, adequate fluids, cough mixture if necessary, rests, fruit and vegetables. Get over it like you would with any respiratory infection or flu-like illness. And in Concern, our main position at the minute is, education for protection and prevention of ourselves and others. And like you hear on the radio every day, the 3 simple steps are hand washing with soap and water, respiratory hygiene. If you cough or sneeze into a tissue, dispose of it carefully or into your sleeve and wash your hands as soon as you can afterwards. And then social distancing, keeping yourself about 3 feet, 1 meter away from people you're talking to if they have a cough or symptoms of coronavirus or even the regular flu, which can keep you out of work for a few days. Interestingly, I see on social media and even on the health websites that a lot of countries now are encouraging people to stop the traditional handshake for the immediate future, to use fists or elbows or even the feet for saying hello or just waving the hands, cutting down on the French greetings in terms of 3 kisses, or in some countries it's 2 kisses, until this epidemic has passed. So it really is about people taking responsibility for themselves and others. And for the majority of people, they might not even know they've had coronavirus. They might just think it's a cold. And that's a problem for people who are vulnerable, because unsuspectingly, again, like HIV in the past, you could be passing it on to another person unknowingly. So, we're hearing more and more numbers now, but that's because more and more people are testing and are found to be positive. It doesn't mean actually that there's maybe more coronavirus. It just means it's being found and counted. And okay. The trend is in China that I'm hoping we've reached the peak. Most epidemics go in peaks and troughs. I'm hoping we've reached the peak in China, hopefully soon in Iran and Italy, and we can start looking at a downward trend. But people have to follow advice from, as we do in Concern. We had instructions from our senior management last Friday. No travel on Concern business to China, Hong Kong, Singapore, South Korea, and we've an office in South Korea. Iran, we don't work. Japan, Northern Italy, especially the affected provinces. And if anybody is coming back from those places on a personal trip, we'll report to our health office and make sure we don't unwittingly expose other people to infection.
Hopefully there won't be a need for me to come back to you in a few weeks, Breda, or months to do another interview. Hopefully we've seen the peak and it's all downhill from here, but it's too early to say. Okay, to come towards the end of the interview, bearing in mind that it is impossible, Breda, to predict the future of coronavirus, is there any other information that you mightn't have mentioned that you think our listeners on Near FM should be aware of?
Well, I guess it's acknowledging the importance of health. Health is wealth. And in poorest countries where concern is working, weak health systems have limited capacity to either test or support people who are very ill if they contract coronavirus. So it really is important to invest in health. Health is wealth. And from high-income countries to low-income countries, it's interesting for me watching this that a bit like HIV, it doesn't discriminate for whether you're rich or poor. So, health systems should be for all, and we need the best health systems to be able to detect, diagnose, contain the epidemic, do the contact tracing. It's the old traditional approach to stalling epidemics, isolating people, monitoring treatment of the symptoms, and then following up people. And for the general public, education, prevention, and following reputable websites like the HSE, the Ministry of Health in Ireland, the Ministry or the World Health Organization. Don't be seeking advice from false, let's say, sites that don't have the accurate information. Make sure you get it from trusted sources, and talk to people you trust. I mean, phone your local GP, talk to nurse colleagues or friends, medical colleagues or friends, and I'm hoping that everybody will be kept safe and it can be managed, but there's no doubt, you see from the reduction in flights, the economic impact could actually, unfortunately, have a bigger impact than the direct impacts of coronavirus itself globally, and especially in the poorest countries where concern is working.